Alright, so earlier on, guys, we spoke about brain tumors, and I told you guys that brain tumors is basically like, okay, you have your brain in normal condition, but there are this group of cells that are now growing without any rule. Do you understand? The group of cells are growing without any control in their growth, okay? So they grow and they become so large and they can even compress some parts of the brain, okay? So you have some cells of the brain growing abnormally. That's what we call a brain tumor. And brain tumors, if not treated, can lead to brain cancer. Do you understand? So now we'll be looking at the different sites, different common sites that brain tumors can actually occur. Do you understand? And basically their characteristics features. So if you have brain tumors occurring at the front side of the brain, what would be their characteristics? If you have brain tumors occurring at the sides of the brain, as the parietal side of the brain, what would be their characteristics features, right? That's what these lectures will be about, right? What is the focus for this lecture? To discuss about different sites of brain tumors and their characteristics features, right? So this is a brain tumor, right? Basically an abnormal group, an abnormal, how will I put it? Um, cells of the brain, right? A group of cells of the brain are basically growing abnormally, okay? So as they are growing abnormally, around it you should find inflammation. Do you understand? So brain tumors can lead to inflammation, and these inflammations can also even lead to the formation of pus. Do you understand? So basically, space occupying lesions. These are basically brain tumors that are grown so large and are occupying large parts of the brain. So anything occupying a large part of the brain is basically causing increased pressure. All right. So you have space occupying lesions. They basically give you the features of raised intracranial pressure. Do you understand? Then frontal brain tumors. Frontal brain tumors, you have mental apathy, personality change. The person will like somebody that used to really look neat before should actually change up. Do you understand? Then the person should have the patient could have dementia. There's anosmia. Anosmia suggests a meningioma arising from the floor of the anterior cranial fossa. Do you understand? Then we have temporal tumors. These temporal tumors are basically occurring at the temporal side of the brain. Okay, so if anything affecting the brain around these temporal sites, the patient can have fits. What is fits? Fits is basically seizures, right? They could have speech disturbances and contralateral hemiparesis. Okay, there's basically paralysis occurring on one side of the body, but this paralysis is occurring on the opposite side. Do you understand? So if you have tumors on the temporal side of the right brain, then the paralysis should show up on the left side of the patient. Do you understand? Then also the patients who have visual field defects. Okay, so you could see this is a meningioma. I said that once somebody has anosmia, that's they can't really smell again. All right, it strongly suggests what meningioma, right? So there's glioma, there's neuroma, there's what craniopharyngioma, there's pituitary adenoma. All right, that's basically enlargement of the pituitary gland. All right, so guys, these are the various characteristics of brain tumors at different sites of the brain. Okay, so I hope you guys understood this and see you guys in the next tutorial. Bye for now.